Hello, Mr. Mayor. Okay.
Chuck, if you want to, I'm still waiting for one quick update by text. If you want to go, not me first,
Okay, can do that.
great. Thanks.
All right. So I do have 115 straight up, so we'll go ahead and get going. Welcome everybody to our weekly get together on the COVID-19 plans and preparations and concerns here for Indiana University, IU Health, the city of Bloomington, and Monroe County. As always, we are joined by Bloomington Mayor John Hamilton. Also on today's call will be IU Assistant Vice President for Strategic Partnerships and IUB COVID Response Unit Lead Kirk White. Also, Monroe County Commissioners President Julie Thomas, IU Health Program Director for Community Relations and Outreach, Shauna Gerges, and Monroe County Health Department Administrator Penny Caudle, and Monroe County Emergency Management Director Allison Moore. So we will start off with Kirk White as we begin things today.
Well, good afternoon, Chuck and the team. It's good to be with you all today as we start the holiday weekend. It's going to be busy for many of us, though, as we continue a lot of the work that we're doing in the mitigation efforts. And along those lines, at Indiana University this week, we've completed almost 10,000 COVID-19 mitigation tests of our students, faculty, and staff. We're starting to ramp that up even further, and we'll be testing more of our faculty and staff now that we're back up to full operations with classes as well, and have more activity on campus. I think the big part of the mitigation testing is for us to be able to watch on a day-to-day, week-to-week basis about where we might have an uptick in infection or an uptick in close contacts, and then that allows our contact tracers to analyze the problem and report that back, and so that university leadership can approach the issue and see what we can do to mitigate the further spread. That's the strategy that is working as we do the testing. We continue to, on many fronts, work with our whole university community, explaining the importance of continuing this responsible behavior of mask wearing and distancing, and staying in, not congregating in large groups. And we've seen a lot of good success with this. We've had a few bumps along the way, but the key here is how well people cooperate with the guidance that's we've talked about all summer, and as we've oriented students in the university community as they've come back to campus. That's really going to depend on how well we're able to mitigate the spread of COVID-19 at IU Bloomington. So I'd just like to finally say this past week, we've also seen an increase in cases from our mitigation testing. A percentage infection increases at our Greek letter organizations, this congregant living that's on the campus that 2,600 or so of where our students live. This is very concerning for us, and that's why we've worked with the local officials at the health department to make recommendations about how they should continue operations, if at all. This has been a difficult situation for us, and particularly for the young men and women who live in those houses. When we understand that, we're doing what we can to support them. But it's also important to note that we're working with their chapter leadership, their corporation boards that run these chapters, that are responsible for their ownership and operation and insurance and things to that effect, and their national organizations. We feel like by helping them navigate this, that they can manage things better for a safer environment. Some of them, a lot of this all depends on the layout of the house, and some of them have facilities that can allow a much reduced number to still live there and quarantine safely. So where that's possible, we can provide advice in coordination with the health department on how that might continue. And this, in some cases, can provide additional advice that these national fraternal organizations can use at other chapters around the country. And we're hoping that that may occur as well. So with that, I'll conclude my remarks, again, thanking our local city leaders, county leaders, and particularly the health department and her and Penny Cottle's team for great cooperation in helping us do the best we can for public safety over this past week. Thank you. Thanks,
Kirk. And I want to update a little bit of those numbers too. And so you mentioned this week's numbers. To date, we've conducted over 20,000 mitigation tests at IU Bloomington. Approximately 20% of those were housed Greek students. 60% of those were students from dorms. We will have full results of week 2 testing in our dashboard on Tuesday, and that will be Tuesday because of the holiday on Monday, normally updating that on Monday. Our results do continue to indicate positivity rates in Greek housing significantly higher, as Kirk said, than any other group of students. So next we'll go to Mayor John Hamilton.
Thanks, Chuck, and thanks everybody. Good to be with you again in front of this holiday weekend, which does remind us how important it is to all of us do the right things during this holiday weekend. We know there have been experiences here and around the country where holidays can cause a spike. Just some quick updates. I think it is of great concern to see the positivity rates that we've been seeing, in particular centered around the congregate living in the Greek houses. We will need to be working very closely together to plan and to outline options for that. I know Indiana University is working closely with those facilities to assure that those who are infected with the disease that test positive do the right thing to isolate and quarantine the houses. It's a complicated situation. We're working closely on it. I know even this week we were, as a group, trying to answer the question, which we ask regularly: are there any other things we can be doing collectively to increase the chance of positive outcomes for our community? So we definitely have seen a rise of positivity, particularly in those locations, which we appreciate IU taking the steps that they do. I think the challenge for the community is making sure we're doing everything we can to identify and isolate those individuals. If they're going to be leaving the Greek house, where are they going? How do we manage them in terms of maintaining the appropriate isolation and quarantine? And I know there's a lot of good work on that, and happy to discuss it more. I know you hear from the hospital too that they continue to see risen but not as high levels. They seem to be stable, which is great. I'm sure we'll get the latest data on that, and we'll just keep asking, are we doing all that we can locally to limit the spread? We're going to keep the city executive order in place, limiting to 15 or less any social gathering. We have had about 24 requests for exemptions. They've gone through our process. They primarily are either a wedding or reception, or often a Bible study, religious related event, not a church service, but a related event. All of those have been able to approve. They've averaged about 30 people in size, and each of them agrees to protocols for distancing and masking that we think is keeping things safe, but we're really pleased to have those smaller numbers. I can also report the City of Bloomington Utilities, the wastewater utility, has completed its 3rd week of sampling of the waste streams, and in 8 different locations. We will be continuing to share the information. I can just share that the areas of the city that are predominantly non-student housing, so those areas that are predominantly non-student housing, there is little to no virus being detected. Consistent with what you've heard from IU and what we see, the sites that do have detectable or significant levels are consistent with those IU findings, centered around student housing facilities both on and off campus. So we each week have identified, we're still, I would say, 50-50. We're not out of the woods, to be sure. And there's a lot of work to be done, and appreciate all the collaboration on that. And I'll be happy to take questions at the time. Thanks.
Okay. Let's next go to Monroe County Health Department Administrator Penny Caudle.
Good afternoon. Thanks, Chuck, and thanks for the updates from IU and the city. We do continue, like everyone else, to monitor the increase in numbers of cases that are being identified and working to understand what all of the tests mean. I know we have received a lot of questions about the dashboard and the increase in the positivity rate that we've had, and we are concerned about that. We are watching that. There is certainly some lag time, and you can imagine with all the universities doing the large volume of testing that they are, that it is expected that positives will get entered into the system first because they are a priority, and entering them into the system is what activates some of the follow-up. Negative test results then are a little bit lower priority to enter into that system. So we do think part of what's happening is that all of that information, certainly while it may be reported, hasn't all been entered yet into the systems. I cannot say that with 100% certainty that that's what's happening, but that's what we think is happening. And we continue to watch that and monitor it very closely because we don't want to make an assumption that is off base. So we are communicating with the state health department, and certainly we talk with the university people daily and generally multiple times a day. So we are following that very closely. We continue to work with not just the university, but with our local schools as well. And I will echo what the mayor said about coming into fall and this holiday weekend, and that we have typically, we as a county and as a nation have seen increases in cases post-holiday weekends when people kind of let their guard down perhaps and have those family gatherings or some social events that they might not have had on a regular weekend. So I would just ask everyone to be mindful about their actions. We all need to be careful about our activities, our actions, and do all that we can to reduce the potential that we might be spreading infection and transmitting that to other people, but we also want to protect ourselves. So if we work well together and we each do our part, I think we can get through that. We are continuing to work with the Greek houses, and I want to say that the response from them, they certainly have been concerned and have lots of questions, and I feel like they're responding very proactively, trying to do the right thing and wanting additional guidance, and we're continuing to work with them on that. We also, most of our exemption requests are about wedding receptions. Of course, weddings themselves are considered a religious ceremony. We do have some public events that are coming through the exemption process. We've had about 33 complaints this week. Pretty typical for us. That seems to be the standard. Businesses, we do want to remind businesses that they do need to post their COVID plan. So with the whole reopening, when businesses reopened, they were supposed to have a plan, and that was supposed to be posted somehow and available for the public. So we do want to encourage and remind businesses of that. And as we come into influenza season, I'll remind everybody, please get your flu vaccine, and you can start now, make plans to do that. We are certainly working on vaccination clinics for influenza as well, school clinics and community clinics. And we continue to work on plans for COVID vaccine as well. Most likely that will be in 2021. We don't have a lot of specific details about that vaccine at this time. I can tell you that it looks like it will take 2 doses, 3 to 4 weeks apart. There will be multiple manufacturers and people will need the same manufactured vaccine each time. And so that does add a level of complexity to getting that vaccine out. So we do continue to work on that. It looks like individuals under 18 and who are pregnant will not be in that first round of vaccine approval. But again, all of that is just what we know at the moment. None of it is written in stone. And lastly, kind of going with being mindful and kind, I found this statement today, and I just kind of want to share it, that the pessimist complains about the wind, the optimist expects it to change, and the realist adjusts the sails. And I will tell you that all of us on this call are adjusting the sails minute by minute. These times are tough. They are constantly changing, and it's difficult. And that raises stress levels for individuals who are dealing with this. And that can lead to actions that might be out of the ordinary for us, for people to say things or do things that they might not ordinarily do and they might regret after the fact. So again, I just remind us all to take a breath and be kind to one another. Thank you.
Also helps when the wind can't mess up your hair, just speaking from personal experience.
Yeah, there you go.
Let's go next to Allison Moore.
Thanks, Chuck. What a great message to follow. Thanks. I want to start with the blood drives we have scheduled for the 2020 calendar year, and we still have 4 left this year. September is open on the redcross.org website, where you can go and make an appointment to schedule your time allotment to make that donation. It is going to be September 29th. The remainder, the final 3 are not yet on the Red Cross website, but you can mark that day down and remember. And then when it gets closer to those times, then I challenge you to go to the redcross.org website and make that appointment. And those 3 times are October 14th, November the 9th, and December the 21st. I'd also like to report that we are receiving 2 pallets, a very large amount of PPE supplies. We have received notification that they were coming today. I think that's going to be shifted with some logistical challenges that they had at the state level, but we'll be getting those on Tuesday morning, and we'll be storing those for our first responders and, of course, any needs that might arise in Monroe County for the current up until the fall. And so I'm happy and excited to get those supplies. We've also secured disposable masks for our fraternities and our sororities for Indiana University, and we're working on the distribution to have those supplies going to them this week. And they've again been wonderful to work with, trying to just simmer that situation down. And it's, of course, it's just taken everybody, and we'll continue to be kind to one another and to do our part in social distancing and wear masks to help prevent COVID-19. We also do have masks available in doing that throughout the county. We have those at trustees' offices and fire departments. And if you are a Monroe resident and you do need one, you can get the list off of our county website at co.monroe.in.us and make an appointment. Go pick one of those up for yourself free of charge. That's all I have today, Chuck. Thank you so much.
Okay. And today we will go back out on location with Julie Thomas, who can explain where she is and give us her report.
Hi, everyone. I'm happy to be at the Hoosier Hills Food Bank today, helping to load up food and nutritious food for the people of Monroe and the surrounding counties. With Penny Githens. Commissioner Penny Githens is with me as well. Commissioner Jones is working on her farm appropriately enough today, preparing for market tomorrow. I just want to start with just to ask everyone to take a step back and think about what we're going through and what it all means. Professor Ann from the University of Washington has offered some really important insight into how we can become desensitized when an acute threat becomes a chronic threat. And with 6 months in, I would say we're at chronic threat. We need to keep cost and reward assessment in mind as we make decisions, especially for things like social gatherings, and especially at times like holiday weekends. The cost of not attending a gathering may be felt immediately. We may have a short-term reward by attending a gathering. We probably shouldn't because it's too large. People aren't masked appropriately. That's an invisible thing. And so it's hard for us to register that. Over time, we become desensitized to the risks we take interacting with others during the pandemic. And again, it's been 6 months. So rather than make a rash decision, just do, Professor Bostrom suggests to do is slow thinking. Think about risks, rewards, not just for yourself, but for your family and for your community. I do want to note that Monroe County is offering CARES funding for businesses and social service organizations in our county. This is intended to help defray unexpected COVID-19 expenses that have not been covered by loans or grants. As of September 3rd, we have submitted over $61,000 to the CARES fund managed through the state of Indiana for our local businesses and social service agencies. For more information, go to co.monroe.in.us. And also, please note that there is a township assistance fund. The commissioners worked with the county council to provide a township assistance fund. Every county resident lives in a township. If you are dealing with issues of food and shelter, please contact your township trustee. They will be able to help you with your essential needs. With that, I'll throw it to Penny briefly. Thank you. It's another beautiful day to be out here. As of approximately 1 o'clock, we had distributed food to about 750 households. It's not quite as hectic as it was 2 weeks ago, but we're still seeing a lot of need. Today, in addition to Commissioner Thomas and myself, the National Guard is again here, but we also have volunteers from Crane and from IU helping out today, which has been really, really nice to have that happen. I also would like to let folks know that while Commissioner Jones is not here, that many times in the past, she and her husband Dale have donated fresh produce to Hoosier Hills Food Bank. Because one of the things that her husband believes is that all children should have access to fresh food. And I'll just close with this, just a reminder to everyone that you need to register to vote by October 5th. For information, you can go to monroecountyvoters.us or indianavoters.com, and then we'll take questions. Thank you so much, everyone.
Okay, thanks, Julie. And next, go to IU Health and Shauna Gerges.
Thanks, Chuck. It's good to be with you today. Just a few things. First, I want to talk about flu vaccinations. I know Penny mentioned that earlier. As we continue to respond to the COVID-19 pandemic, getting a flu vaccine this fall will be more important than ever. Not only to reduce risk from flu, but also to conserve potentially scarce healthcare resources. So due to this increased need for flu vaccines, IU Health has ordered an additional 25,000 vaccinations to better serve the community. And every IU Health facility and practice in the South Central region will have vaccines available in addition to 7 flu vaccine sites that are being set up across the region. These vaccines will arrive in the coming weeks, so please keep your eyes out for information on how to receive yours. And getting your vaccine early is very important since it will take 2 weeks for the influenza vaccine to build up immunity in a person's body. The CDC says that while some people who get the influenza vaccine may still get sick, the severity of illness is reduced compared to someone who received no vaccine at all. And just reminding that safety measures such as social distancing, wearing masks, and proper PPE and hand hygiene remain an important defense against COVID-19. These same precautions are also helpful for reducing the risk of flu. We also have a data update. Mayor Hamilton mentioned this, but our region has continued to see a steady state on the numbers of COVID-19 patients that are coming to our facility and within the region. You can see from this chart that the last 30-day trend that we are in essentially a very similar place with cases at the beginning of September, maybe even a little bit lower than we were at the beginning of August. And then again, on our average daily trends by week, you can see in the last 7 weeks, we've had a pretty steady state number. So just keeping you reminded of that data. Also, again, just kind of reiterate some of the things that have been said. Please remember to practice proven safety precautions every day, even on holiday weekends, to help us fight the spread of COVID-19. So again, wearing your masks and ensuring it covers both your nose and your mouth when in public, social distancing, practicing good hand hygiene, and staying home when you're sick. And then in honor of Labor Day, I'd like to take a moment to thank those who ensure we provide high quality healthcare for our community members now and in the future. Thank you to our IU Health team members in the South Central region. I'm proud to work with these amazing team members who display our values of purpose, excellence, compassion, and team 365 days a year. I would also like to extend a special thank you to the approximately 2,600 workers who've worked on the new IU Health Bloomington facility, which will open in November of 2021. We currently have approximately 600 laborers on the site every day, working hard to bring a new facility to our community. And on Friday, August the 14th, we celebrated 1 million hours worked on this new facility, which was a major milestone that few projects ever achieve. The commitment and investment of the workers that they make every day ensure that this new facility is a place of healing that is designed with future growth, innovation, and excellence in mind. That's it.
Okay, thanks, Shauna. We will go ahead and move into questions. Question here from Eric Berman at WIBC. It says for Kirk White and or Mayor Hamilton, I think maybe this might be a Penny question here as well. The university recommended yesterday that students reevaluate whether they want to live in Greek housing. Why just a recommendation as opposed to closing them or quarantining them has been done with about half already?
Well, Chuck, I can start with that. Of course, we have recommended that they take a look at their living environment and their facilities, and can they do proper quarantine and isolation in a chapter house? So the health department has helped them, as the university has, to look at what those requirements are to do this safely. Now, the university does not have the authority to close them. That would be in the purview of the Monroe County Health Department if they were considered to be a public health threat. So it's not in our ability to do that, but we're here to help them as best we can and to raise the issues to see that we make sure that they're in a position where they can, if they're going to stay in operation, that they do it safely.
I don't know if Penny wants to add anything, or you want me to go first, Penny? Well, these are, as Kirk kind of indicated, and Penny also, these are complicated situations, very fact specific, that can depend upon physical space, level of incidence. It is really complicated, I think, to decide from a public health perspective. Not a public health expert, but to decide is the right thing to keep people there and manage their infections and their isolations on site, or is it better to send people away or send some people away, isolate some people? I do think the rise in these cases means we have to be sure collectively really to dig into that. It is not necessarily a good thing if there are a bunch of infected people to send them back to their homes where they may infect others, nor to off-campus places if they have to find that location. On the other hand, sequestering in site, quarantining in site, on site, can be difficult depending upon the percentage of those infected and such. So it's unfortunate, as was indicated, these facilities, kind of like a senior living center or whatever, had to really dig in and develop some protocols. And I think they may not have had the resources to do it. It also reminds us that we haven't had kind of a national guidance and solutions to these. So it's really complicated right now. I appreciate IU and County Health working to figure this out with all of us, making sure that if somebody has tested positive, they get tracked, they get isolated, that their contacts get contacted, and managing all that is very fact specific with a lot of moving parts. But it's the right question. There may be appropriate solutions that can vary depending upon all these factors in a given situation. I think, and I know County Health and IU are working really hard to manage that.
Yeah, Penny, I don't know if you want to elaborate on that.
Sure. The thing that I would just remind everybody, one, each house is different, and it is these students' homes. And so, we have to keep those things in mind. So that is why we continue to work with them in making the best decisions they can. We want to make sure that we can intervene and stop the transmission of this infection so that we can go back to class, we can go back into those normal activities. And it is complicated, and we do want to work with them. They're reevaluating plans that they had, and we're working with them on that and looking at ways that we can support them better. And it is a continuous improvement process, really, that every day we try to figure out how we can do better today and tomorrow.
And it is a continuous process. And we should point out that, of course, the residential hall rate has just not been at the same level for positivity. And we are focusing on those Greek houses because it just has been so much higher. And this is a decision really made with the health of the students in mind, first and foremost. Next question from Ethan Burks from WFIU, WTIU. And this is, it's for anyone. Mayor Hamilton alluded to some of this. If the desire is to send students in Greek housing home or to other living arrangements, what kind of concerns would there be about individuals spreading the virus in their hometowns or other areas of Bloomington? Mayor Hamilton, I don't know if you want to elaborate more on that, and Penny, if you want to talk about that.
Sure. If I can.
Go ahead.
Yeah.
Go ahead.
Sorry. One thing I want to be really clear about is that at no time do I feel like we were ever saying that any student or faculty member should get on a plane or a bus or public transportation to go home, right? It was about, if you are ill, can you safely go somewhere else to recuperate so that that house has greater capacity to handle the students that remain. And I know that sometimes there's been confusion, I feel like, around please, go home. It is, can we find alternate housing? And we did ask early on for houses to try to come up with plans and alternate situations. I think that none of us anticipated COVID-19 to be here as long as it is, or to the extent that we're having to deal with it. And I will go back to continuously changing our plans and our next steps, because we learn every day and then we have to adjust to that. So we're really just talking about being able to remove people from the house so that they cannot be a risk to the people remaining in the house, if that's possible. And there will be some houses who can successfully, truly isolate students, and there will be houses that simply don't really have those means. And that's why it's a very individual process as well.
I would just add, your direct question is, what kind of concerns would there be? There are very real concerns about how those individuals move about as Penny Cottle just described, very fact specific. I'm hoping that we have to find the best way for any given individual who's tested positive to be protected, make sure they're healthy, and make sure we limit their spread. That may mean staying where they are. It may mean going back to a family. It may mean going to a different location. It may mean IU may consider, I hope, using their on-campus isolation if there are circumstances that merit that. I'm sure they would. But they're very real concerns, and they're so fact-specific. It just demands a lot of attention. And thanks for the health department for being so focused on that.
Another question from Ethan Burks. This is for Penny. With this week's surge in cases, are you worried at all about sending MCCSC kids back to school next week? What has the communication been like with the school district? Is it possible to delay sending the students back, or is it a foregone conclusion that they'll be going to school on Tuesday in the district's yellow phase?
Well, as I mentioned before, we continue to work with the university and the local schools. We do serve on MCCSC's metrics committee, and that group will be meeting to assess that. There's certainly more than one piece of information. You've heard me say that through all of this, that it is a puzzle and it's looking at a variety of information and trying to figure out where we are and what the best next step is. So that's a decision yet to be made by the school and the metrics committee, and certainly are looking at it. Is it a concern? Yes. Every time that we look at the data and we see that COVID is in our community, that is a concern, and that isn't going away anytime soon. So there are different levels of concern that we have. Again, we're trying to get a clearer picture of whether or not all of the tests have been in and entered into the system. Is this sort of a false rise? We know that we have cases in our community and the cases are increasing. Increased testing doesn't cause increased infection. It just means that we are finding the infection that's out there. But we also, to get a clear picture of what that prevalence is, we need to know how many negative tests are done as well. I hope that answers your question, Ethan.
This one from Dave Askins at the B Square Beacon for Penny. There are two kinds of positivity rates that the state is posting on the dashboard, the one for all tests and the one for unique individuals. The way the math works makes the one for unique individuals higher. Do you know which one MCCSC is using for its metrics? Does the health department have an opinion on which one of those is more appropriate to use in this context?
Well, certainly they're both good pieces of information to have and look at. And the cumulative overall is a look at it over time. And that 7-day rolling average is giving us more of a picture of what's happening right now. So both are important and piece of information. I do not have that exact metric with the columns right in front of me, but I can tell you that we are looking at both of those when we look at the information. So I know that metrics, that color-coded metric for the school did include one specific one, but certainly both are being looked at.
Okay, question from Aaron Cantrell from Fox 59. This is for Kirk White. Aaron says he's spoken to Greek students and parents who are very concerned about not having housing or being asked to move or being asked to move. What is your message to them about being concerned and upset? The parent I interviewed today said, I feel like the university is discriminating against students in the Greek system. And again, Kirk, of course, this is being done with the safety of the students in mind, just with the situation that we're in.
That's right, Chuck. And Aaron, thanks for your question. I'm glad we're having a chance to talk about it. I feel the compassion and empathy for the Greek letter students. My daughter lived in a sorority house for a couple of years while she was an undergraduate, and I depended on them to provide a safe and a comfortable living environment for her, and they did so during those years. It was a great experience for her. And I understand this perception that the university is, or the health department or whatever, is discriminating against the Greek students. Not the case at all. It was very clear to us from that first set of mitigation tests at the end of the week when we analyzed things. It was clear the residence halls composite was about 1.8% positive, and the Greek system was 8%. And in some of the houses, it was much higher. And so the whole concept of mitigation testing is, if you see something start to spike up where there are additional cases, then we're going to test more there to find out where the problem is and get it isolated so that it doesn't spread anymore. And that's exactly what we were trying to do with our Greek chapters, was find out where those concentrations are and get those people in quarantine or isolation. And they, we talked to them over summer about having those plans in place. And as we've said, they all had some kind of plan, but some of them just didn't have the capacity to quarantine or isolate the number of people that are now testing positive. They could easily handle 1, 2, 3, 4 cases of positive or people that needed to be quarantined, but larger numbers, they just didn't have the physical capacity to do. So I understand this perception about scrutinizing the Greek system more. Believe me, if we found it at another part of the university, we'd be turning up the testing on that particular segment too, in order to do exactly what mitigation testing is designed to do: find it and get it isolated.
Yeah, and again, to repeat those numbers we talked about early on, to date, we've done 20,000 mitigation tests. 20% of those are Greek students, 60% are students in dorms. So we are testing more frequently in the Greek system, but it's not that's the only place we're doing the test. We're doing it in the residence halls as well. Yeah, Mayor Hamilton?
I might just add, look, when you follow the science, and the science says you got 5 times as high a positivity rate in certain areas, you got to follow the science. And that means you respond to that where you have the surge like that. I do think the request to IU, and I would add to it, just to consider, is there opportunity to facilitate with quarantining, not just for students in residence halls, but others, if there is capacity. And I know IU is managing that capacity. As I understand it, it's not very full right now, and I know you need to manage that carefully, but where there may be circumstances where a Greek resident or off campus even may find the best solution is really isolation, that kind of site. I hope the university will look at that, and I'm sure they will, but it's following the science. It's not, if you call discrimination treating somebody differently because they have more infections, then that's following the science, because that's where the infections were growing.
Next question from Aaron does have to do with that quarantine space. Kirk asking about if there is a chance the university would be able to open up more space for quarantining Greek students, meaning that residence hall space. It's worth pointing out that the residence hall students are paying a contract to the residence halls, so they're being moved to another residence hall space.
Yeah, that's exactly right. We have a contractual agreement with the residents in the residential programs and services facilities, about 10,000 of them. And what we've done is set aside over the summer an entire residence hall for quarantine and isolation, because we looked at the numbers and said, all right, what would we think we would need to handle those students living in our congregant living environments in the halls? What would we think we would need? And so that's why we put these 560 beds aside. The occupancy rate there is going up by the day, and we're keeping an eye on it. I wish I had more buildings. We are frankly in a good spot at IU because we actually had a building we could set aside. Other universities don't have that flexibility. The other thing I'd say is that we did work with the Convention and Visitors Bureau weeks ago and said, hey, if additional quarantine and isolation space is needed, can you help us find a list of local hotels and properties that'd be willing to make this available to students? And we've circulated that list, to our Greek Affairs office, which is then turning it on over to the chapters so that they can contact these hotels directly if a student needs to go there for a 14-day quarantine period.
Question for Penny. How does the health department handle violations/citations at Greek houses? Would so many violations make the health department shut down a house? Do you have a total number of violations citations issued to Greek houses since classes resumed?
Well, we have not issued any violations. The recommendations that the board put out earlier in August just became regulations this last Friday, and those got sent to the Greek houses just this week. And, you know, again, issuing citations and fines is never our intent. Our intent is to always work with them, and that's been my message to all of the Greek houses when they have called to ask questions, tell us what they're doing, is that we will work with them. We just want to work together for compliance, for the safety and the health of all the students and the workers who are in those homes. We recognize that they are their homes. And, you know, in terms of closing them down, when we say that we recommend you should quarantine, that is pretty much as closing you down as we're getting. But again, that was a recommendation to really stop the spread. It's an intervention, if you will, in terms of slowing the spread of the infection and getting a handle on this before everyone in the house is ill, and then greater spread outside to their friends and family. So again, it's complicated, but our goal is never to have to issue any kinds of fines or citations. We want to work with them. And I think that, I hope anyway, that everyone who has called and that we've talked to has gotten that message and feels that way. And I feel like they've been very cooperative. Most of them, you know, everybody has wanted to do the right thing. They've put steps in place right away when things have been evolving. So we're working through some challenges and we'll continue to do that.
And one last one from Aaron, and you alluded to some of this, asking you, Penny, do you agree with university officials' recommendation about students reevaluating their living situation?
Well, what I would say is that we all constantly have to evaluate what we're doing and what our situation is. I guess to some extent, it's how you interpret that. And we just want all of us in our individual homes to think about what we're doing to keep our other family members safe. And that doesn't matter if it's me and my family in our home, or if it's friends sharing an apartment, or it's people sharing their space in a Greek home.
I'm running a little over, but I got a couple more questions we'll try to squeeze in here. From Eric Berman at WIBC, a follow-up to Dr. Caudle's IU reevaluate recommendation stated flatly, the IU recommendation stated flatly, many of these communal living environments are not safe. Do you agree that there are Greek houses that cannot be made safe? And if so, why allow them to remain open, or at what point would the health department issue an order to close?
Well, certainly, again, we're looking, I think when Dr. Aaron Carroll talks about what isn't safe, it's the number of people who are infected. We know that they're ill. They're close contacts, and essentially everyone in the house is a close contact. So we have to look at everyone there is at risk of infection. Again, I would say that when we say that you should quarantine, that is essentially closing the house. And so that's where we are. I know that there's a part of that question, Chuck, help me out, that I've missed. But we feel like quarantine is essentially telling them that they should close while they get through this circumstance. They need to get through the quarantine, get through the isolation, so that they can reopen in a sense of going to class and out and about as they normally would.
Yeah, I think the last part was if there are some that cannot be made safe, why allow them to remain open, and what point would the health department issue an order to close?
If they were complying.
Yeah, we could go to court, but that would get just very, very complicated. I think that, again, we'll work with them. I'm not sure, outside of quarantine and making them quarantine, that there's a lot more in terms of saying that you're closed and everybody has to vacate. That's a different story.
Penny, one more for you here. You said the MCCSC Metric Committee, and this is from Ethan Burks, the Metric Committee will be meeting. Is that before school opens back up on Tuesday? When is that happening, and how likely would you say school will start in person on Tuesday?
I do not have an exact time for that meeting, and that would be a question for MCCSC, as they will be the people scheduling that meeting. And I honestly don't have, at this point, any kind of crystal ball to predict what will happen. We'll watch the numbers even over, the next few days and work through that process.
Okay. That is the questions that we have. Those are the questions that we have, to be correct. And so we will wrap it up for today. We'll join you again next Friday at the same time. Thanks, everybody, for being here.
Thank you, Chuck. Everybody stay safe for Labor Day.
Yes.
Thanks, everyone.